I will go over some e-health interventions, but first of all, these are my disclosures. I want to take a step back, as we did yesterday in the workshop as well, because I think that a lot of you in the audience will have a different opinion on what is e-health. It rings a bell. Somebody will think about internet, the others will think about big data. We discussed artificial intelligence yesterday, so everybody has a different connotation. And actually there's no real definition what e-health really is. It was first coined in 1999, actually, when the internet was rising and when e-commerce and e-business and all this something in the economics were coming up, and that's where the term e-health came from. But there's no definition about e-health, so you can ask me everything it fits maybe with e-health, as long as it's electricity, when there's internet connections, probably it's e-health. So you can fit everything under that definition. I think e-health will really change, as I already posed to you yesterday. I think e-health will change, revolutionize the way we provide medicine, and there's three major factors leading up to a revolution over the next coming 5 years. And I listed them here. One is society. It is changing rapidly, and probably not all of us are really realizing how fast it is. I'll show you in a minute one, I think, classic example of how quick society is changing. The other is patients. Numbers of patients are increasing. We've heard that over many conferences. People will go with pension. We are getting older. Our HIV patients get older, but also doctors get older. So we go to a pension as well. Less doctors and budgets are limited. I will show you in a minute what that is influencing. And these are all creating opportunities for e-health. So this is the picture I was talking about. I don't know if many of you realize that the iPhone was only published in 2008. And now already in 2018, this is how people are behaving. So in 10 years' time, our society has completely changed. And this is, if you just make the translation to how our healthcare system has changed, this is when my grandfather and my own father were practicing medicine in 1960, and this is my own hospital. Well, this is a Google picture, but it could be my own hospital. Nothing has changed. And then, of course, in the audience you will mention, oh, we have MRIs and we have now all these cancer therapies. Yes, okay. I'm not saying medicine hasn't changed, but the logistics, the structure, the way we provide medicine hasn't changed anything, or maybe a little bit. Evening outpatient clinic, maybe some infusion at home, but in essence it hasn't changed much. So this will be a key factor. It should change, society is changing and demands us that we will change. The other thing is, I don't know if you know the term FANG. FANG is an abbreviation of Facebook, Amazon, Netflix and Google, and you can also, Amazon could be Apple, etc. But these are the guys who are going to take over medicine for us. It's not the healthcare system, the insurance companies, but it's the Silicon Valley or maybe the Chinese companies who will take over medicine. For example, IBM Watson Analytics, it's big data, it's artificial intelligence, where they just do retina scanning, thorax scanning, radiology, pathology scanning, and looking for pattern recognition. They do it much better than we do, much quicker than we do, and it just takes time to gather these big databases with enough evidence to really support pattern recognition. But it will take time, but it will come. And IBM is doing it. It's not my own hospital, it's not my government, but it's another company who's doing it. It's one example. The other one is Amazon. If you would be a pharmacist at this point, I would start thinking about a career change, because if Amazon is going to prescribe packages to your home with these drones, although this is a picture, this is an idea, they're not actually doing it. I think in the US maybe in a small-scale pilot. But if this is really the way we're going to bring drugs to the patients at home, this will be a total different landscape. And the last one is Apple. Apple has already a health kit, and it really states it disrupts healthcare. So we have to be careful. If they take over, we are not in control anymore, but it's coming. And I don't want to scare you, but this is just some things which are happening outside our own world. Well, these are the familiar data. You all know this is science, and I'm just highlighting some science, but most is my personal opinion, just to show you what I think is coming at us. These are the patients on ART in the next coming years. It's increasing, as I showed you, as I told you, and people are also aging, so the workforce is aging, doctors are aging, so there's less doctors maybe in future available. So this is one other thing which we might tackle, which we have to tackle to still provide healthcare to our patients. And the last thing, this is something totally not my experience, costs, but you can look up your own country on the side, and here all, irrespective of every country, budgets are increasing, and it somewhere has to stop. for every country. So we have to devise new strategies, new ways which are less costly to provide, with less doctors, provide more care to more patients. I think that's a summary of what I was trying to explain. So there are some nice examples. Estonia is normally regarded one of the leading examples of e-health, how e-health will change the way healthcare is provided, at least in Europe. And they had the, well, nice possibility that they had a crisis when the Russian government, I don't know, in the 1980s took back, they went back and Estonia became their own country. It was a real crisis, economic crisis, healthcare crisis, society crisis, but they used that crisis as an opportunity to restructure their country and to restructure their healthcare. And what they have now, digitalized their whole country. Everything is in databases, everybody is notified, they can track everybody, but it's also providing good care for everybody. So this is a leading example of how e-health, future technologies can revolutionize and help a country in providing good healthcare. So now back to the data. This is some science. I've just listed a few, not everybody, and not every paper here, because there's a lot of papers with small numbers, 10, 20, or 50 patients. So I highlighted here some bigger randomized controlled trials. These are some older studies, mostly with these old type of Nokias. And I showed you the iPhone in 2008. So newer trials, which I show you one example a little bit later on, they will use smartphone technology. But the older trials just used SMS reminders, text reminders by cell phones. And most of the trials are from Africa, actually. But what they show mostly, but not all, there's one non-significant trial from Kenya, but the others mostly see an increase in improved care, retention, or pill adherence. So mostly these initiatives, although you could argue this is also a behavioral change, but mostly if you get a reminder, take your pill or come to the clinic, that will help patients remind and come to the clinic indeed. So most trials are positive. Then there are some other trials, not making use of iPhones, but more trying to really influence behavior cognition by giving computer-based information and trying to really change a behavior pattern, except not only SMS reminders. So that's mostly computer-based. People come to a clinic, see videos, try to answer questions, etc., and then go back and see if their behavior changed. That's less clear, I think, the data on these kind of intervention, at least. Older studies, like the ones I listed here. There's not much in this field, at least not for HIV, which has looked at that. But then the iPhone is really, as I showed you, being popularized. And this is a recent study from 2018 from the US. Although it's not a randomized controlled trial, as all the other trials which I showed you were. So that's a caveat of this study. But I think it's a nice example of how new technologies will change healthcare in HIV. So this is a population of patients in the US who were dropped out of care or as new patients came into care. So there were two categories, patients with poor adherence or bad adherence, or new patients without any treatment experience. So they were sort of naive or not on ART at the moment of start, but it was not randomized, so it was only one cohort. And then they built an app and they provided some things I listed here, like education resources, but also quizzes, medication adherence, appointment reminders. So quite an extensive app trying to cover a whole range of things which patients with HIV normally have to deal with, either appointments, medication, support, information, etc. And the population is quite a sort of normal population, I think, for the US. And what they show, these are just two screenshots from the study where you can see adherence, mood, daily stress. They could fill out. Here are some questionnaires, notifications. So these are, I think, quite a nice app. And what they show is that the retention increased over from 51 at baseline to 88 at 6 months and 81 at 12 months. So quite an increase in retention in care, and also viral suppression increased major from 47% to 79% in 12 months. What they explain in the discussion of the article, as I mentioned, is not an RCT. They say if you just look at this sort of population last year or the year before, and we look at retention in care just the old day when we provided it the old way, it's less dramatic as it is here. So they argue that part of it is just routine care, but most of it, the sharp increase, is probably because of the app. Although it's not randomized, they cannot really make that a true conclusion. The other thing, which I was also discussing with a colleague from the Netherlands yesterday, is app adherence. So we don't know really if it's changing a behavior on the long run. So they, and this is the graph here, at 6 months and at 12 months, they looked at app utilization, and it's going down. So from this side, medication inquiry from 50 to 41% over 1 year, and all the others are also going down a little bit. So the question is, how can we have traction in the app, which developers call it traction? How can we sustain patients using the app on the long run? That will be one of the major challenges, I think, for this kind of app delivery services. On the other hand, if I compare it with, for example, my bank account app or my insurance app, I also use it 1 or twice a year maybe, well, my bank account maybe a little bit more, but I use it when I need it. So the bank would probably want me to use it every day, but I'm not doing it every day. So it's also a matter of what we expect patients to use it. Do we expect patients to use it every day, or do we expect them to use it only when they come to clinic? That's a difference in how we look at these data of app utilization. Do we expect it, and well, we should manage our expectation with the usage of the patients, I think. So coming back to what Charles already mentioned, my own experience with HIV e-health, I started this project called Happi, which is, well, we first started it at HIV Happi, that's why it's called Happi, but now we termed it Health Happi because we think it's not about HIV anymore. We have included so many other things in the app as well that is more about health than HIV only. And the goal is actually twofold. One, the major goal is to give patients maximum control over their disease. So everything, what they are concerned about, everything they have to do with their disease or to manage their disease, in the end should be able to be provided by Happi. And one of the major things, which was also highlighted yesterday already, is the value-based healthcare clues, a component in the app. And I show you just a screenshot here. Everybody can download it. It's free. It's in English and in Dutch for the ones who speak Dutch. But it's free, and you can download it and look through the app if you like. These are the value-based healthcare components Guido already highlighted yesterday, the 4. And this is just an imaginary screenshot where I can do it here. For example, the green smileys already indicate that it's going well with the patient. So if the patient really is doing this at front before he's coming to the clinic, he will have a more effective consultation with me. Before I'm starting, how are you doing, and how is your viral load, and do you take your pills, and do you have any experienced side effects? He will say, well, I've gone over all these indicators, I just want to have my 15-minute or 20-minute consultation, how I can stop smoking. And then you skip all the rest because he already prepared at home and he knows exactly what he or she wants to discuss with you. So the therapy or the consultation will be much more effective, hoping at least that the end result also will be that he, in this case, will stop smoking in the end. So that's one of the items which Happi, the app, will provide in the Netherlands. The other one is to make life easier, as I mentioned. So one of them, what we included, is an easy travel algorithm. So, for example, if a patient is going to Japan, there's an 8-hour time difference. Normally, they would email or call my nurse to make a schedule for the pill to take it at the same time in Japan, and now the app will do it by themselves. One other thing is what we are now working on is prescriptions. Normally they don't know how many prescriptions there still are at the pharmacy. The app will tell you. That's one of the new things we are working on. So making life easier with HIV is one of the other aims of Happi. And we now a patient care pathway, so it gives you reminders to go to the lab, to fill out the forms, quality of life, etc. We have now established a connection. We are the first in the Netherlands to have a connection with the hospital, so direct communication between the app and the hospital system. And I was talking to people from Sweden and Finland, where these kind of connections between apps and hospital systems are also an opportunity or something which is available, which I think really increases the uptake and the usability of such a device. So this is mandatory, I think. If these apps are really going to help patients, they should have a direct connection to a hospital system. So how will this go forward? These kind of approaches, I think, are really, as I mentioned before, the way we have to go forward. But it should be integrated, as I mentioned. The connection to a hospital should be integrated, that's one. Actually, that's the other, hospital connectivity. But it should also be together. And what I mean with that, for example, my mother-in-law has a Fitbit, and she is very proud that she has 8,000 steps a day. But that doesn't really tell you something, only that you have 8,000 steps a day, and hopefully you will think, okay, I lose weight, and then if I probably stop smoking, it will eventually help my cardiovascular disease. If it's all integrated in here, so if it's not yet in the app, but if we would connect with the Apple iKit, so the footstep is already imported, the blood pressure is imported, and it will be all integrated, and it makes more sense to do the 8,000 steps, because if you integrate it and also stop smoking together, and you see immediately what it does on your cardiovascular results, that will be a major challenge, a major step forward, and not for every part of your behavior you need another app or another connective device. So I think we will go to more integrative apps and connected devices together over the next coming years. And also depending on your architecture in the hospital, of course, or in your country, I mean, connections with hospital between apps and other systems, it's one mandatory step we should take. Of course, there are a lot of challenges, and we discussed that yesterday briefly as well. Also in my country, and with our app, we have the same problem or discussions about identity. So is my data really safe? How do you protect my data if it's somewhere in a database? That's also the other term, security and safety. And I'm not sure if I mentioned it yesterday, blockchain will, I think, revolutionize identity and security and safety issues. But then we have to trust the guys who develop the blockchain technology and learn more about blockchain technology, I think, but it will really revolutionize and tackle all these parts. Similar to long-actings, which we discussed, education is another one. A couple of years ago, nobody would thought that my grandmother of 95 would use a FaceTime and an iPad, but she also had to learn, and we all have to learn, and we also have to teach and learn our patients how to deal with these kind of technologies. And if they use an app, how to go about it, and we have to learn ourselves. We shouldn't look at the computer screen all day or look at our iPhones all day, but also keep communicating with patients. So educating ourselves and our patients to use these technologies is also very important. And another issue which I don't have a real answer for at the moment is business. How are we going to finance this? How are we going to finance these nice apps or these connectivities? Our health insurance companies might do it, maybe our government might do it, but these are things we have to work out still. So I think as I started this talk, digital revolution or e-health will revolutionize the coming years. There are three factors which really make it a healthy environment for these changes, but we have to make sure that we are at the front of this revolution and not let the guys from China or from the US take over, the big firms take over. Smartphone is the key element which will guide this revolution. Patients have it, we all use it for everything, and we will also start using it for our providing health care, I think. We need more studies. That's one of the problems at the moment. I showed you a couple of studies, but we need more studies, and we need more awareness of how these apps and how these healthcare tools will really help our way of providing healthcare, and it should be proven in RCTs and hopefully published also. And of course, my latest slide, technological, ethical and social challenges still exist, and that will differ country by country by country, but in the end we all will go through this e-health pathway into the future. And with that, I would like to thank you. This is the foundation Guido and I are hosting the Happi app from. You can reach us if you have questions about the app or download it, or you can reach us via the emails on the slides, and the presentation will be on the website of Virology Education. Thank you very much.